Okay, so if you're a patient you're measuring range with, the first thing that is the best for them is making them comfortable. Okay, so it's not just torture, because it's painful for a lot of them. So getting to know them helps put them at ease. So usually if you're starting with them and it's someone you haven't seen before, do some other things first before you start with range of motion, just to kind of get them a little bit acquainted to you and warmed up. But so each of those motions, you're gonna help bring them through the motion. Most of the time you'll feel like a painful end feel, meaning they'll tense up, and you'll see it in their face, and it'll start fighting you. Okay, so you want to try to get them to relax. I do a lot of oscillations just to try to loosen up the muscles, and then I'll push back a little bit further. Okay, and you'll be able to feel when they stop. Until you get used to that though, tell them, we have to push because we need to get range back. However, if it's really, really hurting, make sure I know that. Okay, same thing for abduction. I usually will kind of hold here to stabilize the scapula so that they're not coming up like that. And then you're gonna push that way. Okay. Adduction across the body. Same thing, I'll kind of hold the shoulder so it's not everything going over. Internal and external, just make sure they're, again, perpendicular to or parallel to the ground at their humerus, and then you're just pushing back that way. Normal is pretty much parallel to the ground, okay, so you don't really need to go into that range. And then internal. Okay. Now mobilizations we'll do sometimes too. So basically you have the head of your humerus in the glenohumeral joint, and you're doing mobilizations to kind of break up scar tissue in that area after surgery or something like that. So I typically will do them resting here. Your hand is right below the joint, and you're pushing down into the table. So it shouldn't hurt them, okay? So I usually do that one, which is posterior. And then I'll do inferior. And sometimes I'll do anterior, but it's mostly the posterior and inferior ones that I do.